This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. And Thomas, did you know that April is National Minority Health Month?
You know, spring and new life, and so much new life is coming into this whole conversation. Perfect time to be doing this.
Absolutely. And we couldn't have a better individual than Dr. Stella Lisk, who is with Texas Health Resources, and she's the coordinator of the Structural Heart Program at Texas Health Harris Methodist in Fort Worth. Dr. Lisk, welcome to the show.
Thank you. Thanks for having me.
You know, the first question, what is a structural heart program?
Well, structural heart is what we call a collective set of procedures we do for heart valves. Traditionally, heart surgery involves open heart surgery, but structural heart involves all the procedures we do that do not involve surgery. And we find other ways, whether it's a transcatheter valve repair or other procedures that we do to help manage heart disease that don't involve surgery.
Well, thanks for that explanation, and that'll lead me to my next question. How do you define heart failure, and how does it affect an individual?
Well, heart failure is anything that affects the heart such that it's not able to do what it does best, which is pump. It doesn't mean the heart has stopped working completely. If you think about it, the human heart is a muscular pump, beats about 60 to 80 beats per minute to get blood flowing through to our bodies. It supplies oxygenated blood to all the parts of our body that we need, and anything that affects the heart so that the pump is ineffective is what we call heart failure. A lot of times people hear congestive heart failure, which is one of the primary things that happens to the heart when the pump isn't working. We have fluid and blood pool in our lungs, in the extremities, which is the legs, arms, sometimes in the stomach. And when that happens, we get short of breath. Sometimes people have heart failure without the congestion, and that will also cause shortness of breath, fatigue. Sometimes people have chest pain. So really, it's a cluster of syndromes that we call heart failure.
You know, you touched briefly on congestive heart failure. For your patients that are at home that do have this, do you recommend they weigh themselves every day?
Yes, we do. We usually recommend that fluid overload, you know, the extra fluid that can come in and cause you to have all those symptoms can happen overnight. And once you weigh yourself every day, and we recommend you weigh yourself, say, first thing in the morning before you start doing anything, so it becomes a routine. When you weigh yourself, you can track how much that weight gain is coming on, how quickly. Often you can prompt yourself to call your healthcare provider to adjust your medications and sometimes even your diet to help with that.
You know, I know there have been several clinical studies that have concluded that heart failure is increasing in this country, especially among African American patients. Do you have thoughts about the key findings of these studies?
Yes. So on average, you know, about 6.2 million adults in the United States have heart failure. And heart failure is listed on maybe 14% of death certificates. So heart failure is very prominent. Over the course of the years, there's been a lot of work, studies put into taking care of patients with heart failure, medications, therapies, but this has not translated into the African American communities. Even with this improvement, heart failure and heart failure-related deaths are really high, particularly in young African American men and women who are 2 times or 2.5 times as likely as their Caucasian counterparts to have heart failure and heart disease in general. Also, the readmission rates for heart failure is on the rise, in our minority communities, especially or specifically African Americans. And so all these studies have shown that even though we've done a lot of work in the front end in general to help manage heart failure, it hasn't translated for the African American community. In the past, there was some thought that, was access to care and socioeconomic status that helped, that made this disparity that significant. But more studies are showing, or newer studies now, show that most of these factors are due to things that we haven't thought about before, like genetic susceptibility to heart disease. African Americans do, in fact, have a higher likelihood of being affected by sodium or salt intake than our other races. Also, things like what we call social determinants of health. So social determinants of health include things like discrimination, racism, sometimes marital status, education level. Where you live can be a social determinant of health. Residence, access to transportation, maybe, not having grocery stores around the house, healthy foods. Those kind of things are what we're noticing, or newer studies are pointing to, that actually can affect our health, and is why we've seen a significant rise, or we haven't seen as much of a decrease in heart failure cases in the African American community.
Dr. Lisk, do you have stats also for the other population groups like Latino and Asian?
Yes. So our Latino population is just as affected by heart failure compared to our Caucasian patients. They do also have a higher risk of having heart failure and heart failure readmissions. Only their risks aren't quite as high as the African American population. Again, minorities are disproportionately affected by cardiovascular diseases, which do lead to heart failure. But the minority and Asian community do have the Hispanic community does have a higher risk of heart failure related diseases and readmissions, not as high as the African American community in the study that we're talking about.
What's underneath the numbers? What's going on here?
Again, like we talked about before, it used to be, we thought it was quite as simple as, access to care, because access to care makes a big difference, right? And also socioeconomic, if you are not financially equipped to take care of your health, if you don't have insurance, you're not seeing your healthcare providers, these things can all lead to you having less access to care. But what we're finding that there are significant disparities, regardless of those, as far as having, where you live, having access to transportation, even grocery stores. And unfortunately, a lot of our minority population is affected disproportionately by these things, and that is what is making the numbers worse.
This is Dr. Stella Lisk. She's the coordinator of the Structural Heart Program at Texas Health Harris Methodist Hospital in Fort Worth. April is National Minority Health Month, and this year the Office of Minority Health is focusing on the disproportionate impact of the COVID-19 pandemic, especially on racial and ethnic minorities. And we're focusing on heart disease. We'll continue the conversation right after this quick break.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And we're glad you're back with us. We're talking to Dr. Stella Lisk, who is the coordinator of the Structural Heart Program over in Fort Worth at Texas Health Harris Methodist Hospital. We're going to talk about some of the things you can do to keep your heart in better health and what to do if it is not. But first, in the last segment, we talked about a particular study that shined a light on the impact of heart disease on minority communities. Now we're going to turn the camera on ourselves, the healthcare industry, with a very important question in light of that study.
When you look at these findings, that's one thing. How can the healthcare community, if you will, take those findings and truly address the problem?
So, it's any healthcare provider out there needs to be aware of these findings, understanding, the complexity of heart failure and how it affects the African American community and minority patients. It will help maybe tailor your practice, knowing that, when you're seeing the patient. I mean, of course, you have to do that for every patient, but particularly in this community, you have to be aware of, where is your patient coming from? Where do they live? What are all the determinants that can affect their heart health? Also encouraging things like research initiatives. A lot of times, patients don't sign up for research, and also providers in our practice don't make time for research, but encouraging those so that the results can be used to help change care. Patient education, tailoring your patient education. For example, diets and foods that are specific to the African American community, so that if you're educating a heart failure patient that's going to go home that needs to monitor their diet to help impact their disease, those are things that you can be aware of, if you educate yourself to help guide your African American patients as far as managing their diseases.
Thanks for that answer. And I'm going to pivot just a little bit. To our listeners out there, maybe they suffer from heart failure or they have a family member or friend. For individuals, regardless of race or ethnicity, what are the treatments for heart failure?
All right, so to begin with, the best thing to do is prevention, right? Preventing heart disease. Heart disease is totally preventable. We have genetic factors that predispose us to heart disease and heart failure. But managing your weight, making sure that you're getting out there, getting some exercise in, watching what you eat. Those are all kind of things that we can do. Don't smoke. If you smoke, cut back on it or decrease it. Cut back on alcohol. There's so many things that we can do to help prevent the disease. And then if you've been diagnosed with something like hypertension, diabetes, kidney disease, those are all things that we can do more to help keep us healthier in spite of the disease. So if you have hypertension or diabetes, listen to your healthcare provider. Take your medications as prescribed, follow the health advice you're given, keep your appointments, find community resources, decreasing stress, something like that can even help in the disease trajectory. Now, once you're diagnosed with heart failure, again, it's the same thing. We do so much to help kind of guide and educate our heart failure patients, but your healthcare provider can only do so much. So if you're given medications, weighing yourself daily, it makes a big difference. It can be a nuisance, but weighing yourself, monitoring your sodium or your salt intake, if you're eating out, watch where you eat out, or make sure you're asking for a decreased sodium, things like that. Healthcare providers, most people taking care of patients with heart failure, can give you specific guidelines as to how to manage your disease. And once you follow that, if we follow those things, they do make a significant difference. And then when you have heart failure, we have medications. We have good medications now. There's so many newer medications that have come on the market. They're medications that we've been dealing with for years, that have been studied, and we know help. Sometimes when we're asked to take medications, we think, especially for heart failure, some of the medications we're given are 2, 3 different types, and people get wary, but all the medications are there for a reason. We also have ways to treat underlying diseases like valvular heart disease. Heart valve disease can cause heart failure. If you have heart valve disease, we have ways to take care of it. Like I said before, these days, not every heart valve disease warrants open heart surgery. We have devices that we can implant in a person that can help decrease the manifestation of heart failure. When the pump isn't working, there are things that we can put in a body that can help the heart pump better. Transplantation, that's another way of taking care of heart failure. Once the heart pump has absolutely failed, there's a way of transplant. Heart transplantation helps. There are also devices that, again, like I said, we can implant that help the heart pump. So taking care of yourself in the front end, decreasing disease, and if you have the disease, listening to your healthcare providers, taking medications, being an advocate for yourself. Those are all things that can help prevent heart failure, and then if you have it, help manage it.
Some great responses related to the treatment. Let me ask you this, Dr. Lisk. For the last 13 months, we've all been impacted by COVID-19. Have you seen that impact the incidence of heart failure that you've had to treat?
Well, so the most common thing is people are not coming in. So first of all, COVID was really hard on patients that have chronic diseases like heart failure, diabetes, hypertension. Most of the increased deaths were in these patients. And so it kind of highlighted the need to help manage these diseases. But what also happened was people were afraid of COVID, or people still are afraid of COVID, and are not coming in to get care. So we are seeing people coming in more and more sick, versus coming in when they start noticing symptoms like they're increasing weight, shortness of breath. People are waiting for way too long because they're afraid to come into the hospital. So that has been a problem. People need to know that if you're feeling poorly at home, we have ways. Most of the emergency departments have ways of taking care of patients and triaging, people that are coming in with COVID versus those that are coming in with other diseases. So do not wait at home. If you're feeling poorly, come in and get taken care of.
Now, stress. I know this has a big impact as well. How do you see that in light of this context?
So higher stress in the African American community also puts them at a higher risk for heart failure. Discrimination, racism, we discount stress. Stress makes a big stressors in society, in life, in other workplace, puts people at a much higher risk of heart disease. And I don't think we give that enough credit.
Nobody is really escaping this one, are they?
Everybody has been affected. The stress levels in our nation are probably the highest that I have seen it. But I think more so for the African American community, if you add all these social stressors, it's made a really significant impact.
What about the difference between we're getting older and heart failure? How do you draw that line when our bodies start to slow down? Is that our heart or is that just age?
Well, heart failure incidence is higher as we get older. So if you think about it, at an average age of, say, maybe 50, 60, about maybe 3% of us have heart failure. As you get closer to 80, that percentage jumps to about 15%. So as we get older, just like anything, our hearts are working harder. They've been used, and if you haven't taken good care of it, or if you've had something happen in the front end, it makes your incidence of heart failure higher. That said, all too often, things are happening that we can take care of, and we chug it to heart failure. So, how we talk about structural hearts, something like aortic valve disease, aortic stenosis. It affects patients, or mitral valve disease. Valvular diseases affect us, and they can cause sometimes, atrial fibrillation. If that chamber isn't working very well and blood is regurgitating back, the top chamber widens, you can have atrial fibrillation. These things happen, and we chug it to old age, and we think, okay, I'm just getting older. That's why I'm getting tired, and I can't keep up. But most of the time, there are things we can do, exercising a little bit, watching our diet, and getting help for the things that are in place. I'm glad you asked that because, again, something like Texas Health. Texas Health is across the metro, Dallas. We have Arlington, Plano. We have trained specialists in place that when you come in, we're able to kind of go through your health and then help discuss some of the things you can do to help us as we age manage all the symptoms that come up with, sort out what is just aging and what is something that's an underlying problem that we can actually take care of.
And if you like what you've heard and would like to go see Dr. Stella Lisk, she is at the Structural Heart Program at Texas Health Harris Methodist Hospital in Fort Worth, and you would contact that Structural Heart Program for an appointment. Now, when we come back, we are going to stay in Fort Worth. We're on the western side of the Metroplex today. We're going to go to Cook Children's and find out how our kids are being affected, and they are. We'll talk about it next on the Human Side of Healthcare.
Welcome back to the Human Side of Healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
And welcome to the human side of healthcare. Today, as you know, we talk about topics that are so important, and this is a topic dealing with mental health, our children, adolescents, and how we need to do everything that we can to help them when they're having dark thoughts and dark times. We couldn't have a better individual than Dr. Kia Carter. She is the co-medical director of Psychiatry at Cook Children's Hospital. Dr. Carter, welcome to the show.
Thank you. Thank you so much for having me.
You know, I know that Cook Children's is starting a campaign, and it's called the Joy Campaign. Can you explain to our listeners what this Joy Campaign is?
The Joy Campaign is a suicide prevention initiative where we are attempting to launch this series so that we can expose our families and provide enough education and awareness about suicide prevention and depression and warning signs. Joy stands for Just Breathe, Open Up, and You Matter. We'll have a couple of stories that come out that talk about mental health in kids, including definitely the pandemic and the isolation and the effects of that, social media and roles that it may play in kids with depression and suicidal thinking, over-the-counter prescription drug use, as well as different challenges that our kids and adolescents are facing during this time, and then hopefully providing resources for families that may be going through things or notice some of these signs in their kids, what they can do, who they can reach out to, where are those resources at. So we're hoping to bring awareness to our community and to our families so that we can decrease the level of suicide attempts that we're seeing in our kids and adolescents.
You know, you mentioned suicidal attempts. And so for our listeners to kind of understand this situation and this problem, how many suicidal patients do you normally see at Cook Children's?
Well, you know, we started tracking the amount of suicide attempts we see starting in about 2015 when we started to have an increase in awareness in kids presenting to our ER and starting to see maybe a little bit more demand in our hospital for psychiatric and behavioral health services. And recently in 2021, we've seen the highest number of suicidal patients in the month of March that we've ever seen in any month since we've been tracking for the last 6 years now. In March of this year, we saw 43 patients that were admitted to our medical floor as a result of a suicide attempt that needed medical clearance. Also, in 2021, for the most part, we've already seen 118 suicidal patients, which is concerning for us because you know, it's in spring break. And we also had a snow week in the month of February where kids were not in school, people weren't out of the homes or traveling. And so this is pretty alarming for us. So we only suspect that the number will continue to rise, especially with the end of the school year happening, which we normally see a lot of kids present with stress, with grades and academics, final exams, as well as the STAR testing. That normally is a stressor and a trigger for our kids. And so we're just a little afraid about what the next couple of months has in store.
You know, you've touched on this in your response, but maybe we can drill down a little further. This very alarming increase in the suicidal attempts, what do you think are some of the major factors causing this increase?
Well, and you know, we get this question all the time, and we definitely know that the pandemic has played a role in this significant increase. I mean, it's almost double the amount of kids that we've seen in March of 2020 for suicide attempts compared to 2021. But just so we know, for the last 5 years, we've seen the trend of increased pediatric suicide attempts has continued to rise. So prior to 2018, suicide attempts in children were the third leading cause of death, and starting in 2018 and since then, it's now become the second leading cause. So this is something that not only Cook Children's is seeing, this is globally that we're seeing in pediatric mental health, that this has always been on the rise. And now, unfortunately, with the pandemic and the stressors related to that, with virtual school, isolation, lack of resources, our families being able to access that care. So we definitely seen that number take a big jump in the last year.
In looking at some of the things that you've just mentioned behind this increase, I think sometimes we as adults maybe don't realize that missing homecoming, missing a prom, not having a normal graduation, and really a decrease in extracurricular activities can take a mental health toll on our young people. Would you agree?
Yes, absolutely. I mean, we teach our children when we see them in behavioral health to find positive coping skills, find ways to deal with the stress in a healthier way. And as adults, we've gotten to the point where we've learned to accommodate or find what works for us, but our kids are still learning that. So extracurricular activities as far as band or sports or having things to look forward to the weekend or hanging out with their friends, those are all coping skills, to be honest. It's a way of distraction. It's a removal from a stressor. Maybe it's, studying for a hard exam. And so taking those things away have definitely contributed to our kids not having anything to look forward to, no positive outlets that they can use as a coping skill.
If you were talking to a group of children and especially adolescents, and you had them in a room and you said, if you're feeling different, if you're having dark thoughts, what would you advise them as individuals to do?
I work with kids every day. So I'm on inpatient psychiatry where I see kids who are currently in the hospital for depression or suicidal thinking. And what I tell them is that don't be scared or afraid to ask for help. If you don't feel that you can ask mom or dad, maybe tell a friend or tell your school counselor or a teacher. Or when you go to the doctor to get your yearly exam or your immunizations, you can tell that doctor or that nurse. Like, there's so many people now that are very aware of the concern about the increase in adolescent depression and suicide attempts that there are so many more people that can help and support. A lot of our kids are scared to tell their parents, unfortunately. It's just because most parents are busy, parents are working, they're stressed, and so kids tend to believe that telling their parents is going to cause more stress. They're going to have, put more work for their parents. They have to find me a doctor. They have to take me to see someone. And what I explain to my kids is that, actually mom and dad want to help you in advance, because in the end, if you do try to hurt yourself, that's actually more stress for mom and dad. So I'm a parent and I tell them, if my daughter's struggling, I want her to tell me now. I don't want her to be afraid of that, because that's what parents are for. We're here to help our kids have the best life and give them the best things that they need. And if a parent doesn't know, then they can't get their child the help they need.
And likewise, let's assume that the adolescent doesn't approach their parents, and maybe not even a friend or someone else, but the parents now become concerned and they're worried about the behavioral health and mental health of their child. What advice do you have for them? And then what are some warning signs that they should really pay attention to?
I really encourage parents to do kind of a normal check-in with their kids, especially during the pandemic when kids are at home more, are kind of in their rooms or on the computer more and not as active and don't have as many eyes on them. The teachers that are maybe not seeing them in person because it's virtual or different things like that. So having parents really check in. You know your child the best. So if your child normally enjoys going outside or playing or eating dinner with you and dad, and then all of a sudden now they want to be in their room alone or they don't want to be with their friends, then you kind of want to start checking, like, what's different? Why has this changed? And it may be nothing. It may just be your child's tired today. But a lot of times you want to see what's caused that shift, because those are usually where the early warning signs come. Kids are a little bit more tired when they become depressed. Kids are less motivated. They may be a little bit more irritable or on edge. Like, the smallest things can make them frustrated. You look for a change in appetite, in sleep, just those normal daily functioning activities, as well as grades. I mean, grades are a huge factor for our kids when we start to see that their mental health is declining. They start not caring about their grades. They don't have the energy or motivation to study or do extra work. So it's always looking for that shift. And a lot of times kids may not tell you the truth, and so that's why you kind of have to watch and monitor to see, well, I notice, you're not really wanting to get out of bed on the weekends anymore. You don't want to go with mom to the grocery store. Is everything okay? Have you been feeling down a little bit? Or I notice you don't talk to your friends as much. So just kind of checking in with them. And then most of the time, the pediatrician is usually your first point of contact, because normally most parents will see their pediatricians for sick visits, for normal visits, for sports physicals, whatever it may be. And those nurses and pediatricians are trained to screen or help and know what to ask and kind of be able to provide those resources if a child is starting to show signs or symptoms of depression.
I know it's difficult being a parent, But do you have advice for parents related to boundaries? And let me put that in the context. You know, in this day and age of people having their iPhones, social media, is there a time a parent has to really dig into that or make sure they know what's happening on social media involving their children?
Honestly, and that's so hard these days with, virtual and kids being online all day and having so much more access to social media. But I think it's a huge component. Most of our kids that come in have some source of attachment to social media, some access to bullying or knowing something may not be a positive experience on social media. So it's very important for parents to know what their kids are looking at on social media. And again, we don't want you to have to go through all their messages and things like that, but it's establishing what's appropriate at the beginning when you give your child access to social media, and then maybe doing a check-in or having some rules like, okay, well, mom trusts you, but if mom ever asks to look at your phone, this is something that we agree that mom could do, but mom, if I get concerned or I'm worried, this is our rule. Or developing that in advance so that if you do happen to look at your child's social media or something of that nature, then your child doesn't think it's a punishment. I know a lot of parents also create social media accounts just to kind of keep tabs on what their kid is looking at or who their kid's following, and TikTok accounts and all these things. And it's just another way for you to just to kind of have your eyes and ears out there to be aware. It may not be anything that your kid is doing, but it could be someone that posted something that your kid is following that maybe triggers something that you know is inappropriate or anything of that nature. So it's really just kind of tapping in a little bit more to what your child is doing, since so much is done on the internet and on their phone.
This is Dr. Kia Carter. She's the co-medical director of psychiatry at Cook Children's in Fort Worth. When we come back, we're going to tackle one of the top areas our kids are facing, and that is social bullying. That's next on the Human Side of Healthcare.
Covering the healthcare topics that matter most to North Texas. This is the Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're continuing our conversation with Dr. Kia Carter. She's the co-medical director of psychiatry at Cook Children's in Fort Worth. Obviously, we're talking about mental health and our kids, especially around the launch of Cook Children's upcoming Joy campaign. But we're going to start this segment with one of the top issues our kids are facing, and that's bullying.
You know, of the patients that you see, and I'm just looking for a rough estimate, what percent do you say are exposed to some form of bullying?
About 60 to 70% of our kids have experienced some form of bullying. Most of the time it's on social media, to be honest, about the last 5 years or so, since kids can never get rid of social media. In the past, bullying was more physical and direct. When at school someone bothers you or, they call you names, but then when you go home or on the weekends or the summer, you don't have access. They don't see you. You don't see them. But now it's 24/7. You wake up in the morning to get ready for school, or it's the weekend and you have negative messages posted on your social media, or there's pictures or messages sent around the school about you or different things like that. So now it's been a huge component of our kids struggling with being able to have those boundaries with other peers, and peers having that continued access to bother kids. So honestly, we see it a lot. So I would definitely say probably on the higher end of more 70% of our kids experience some form of bullying these days.
That is amazing. I mean, I knew there was a lot of bullying, and I knew what you said. It's 24/7 on social media, but 70% of the patients, that is amazing. That's something I hope our listeners, especially parents, pick up on. I'm going to pivot just a little bit. We've talked about the individual, and we've certainly talked about the parents. But let's say I'm a teacher, or I'm a coach, or I am in some way interacting with a child that is exhibiting warning signs, and I go, I don't know if I should get involved. I'm fearful to go to their parents. What should you do when you're a third party, but you're concerned about warning signs?
So a couple of things. So when you mention like the teacher or the coach, so I'm going to put them in a different category because those people have the resources of their school counselor, their school social worker, their principal or vice principal. There's normally a resource center. So for instance, Fort Worth ISD has a family resource center where when teachers or coaches or whoever have concerns that are in the school district, they can make a referral for that child even without the parent being involved to kind of say, I'm worried about my student X and this is what they told me today. I just wanted to put this on someone's radar, and then that person could reach out to the family, reach out to the child, things like that. So normally in a school district, it's a little bit more protected, and there's kind of, levels of places to go to get that help. So it doesn't necessarily just have to be the parent, especially when you're not sure exactly if the kid is really struggling, you're just a little worried. So that's where that safe place of having a counselor and a school social worker are really there to support those other ancillary staff. As far as like in the community, like a aunt, uncle, friend, things of that, that's a little harder, because I think the hard part is your direct line is usually from that parent to that child. So I think it means reaching out to try to see another friend or another adult who's ever experienced this, or if you have a resource to that child's school or that child's doctor, kind of tapping in to say, oh, I seen little Billy this weekend. I just wanted to let someone know I was really worried because mom is not worried. If it gets bad enough where people don't feel that a parent is aware and open, then anyone could always call Child Protective Services and make a concern or report that a child is experiencing severe mental health concerns, and they're concerned that the parent is more neglectful of that. That's usually a last resort, but if someone gets to that point where they don't feel that they can reach the parent to support the child, then Child Protective Services is always a last resort.
Dr. Carter, when I was young, and this was a very long time ago, I'd watch cartoons and I'd see Roadrunner get run over and he'd pop right back up. Or in another cartoon, he'd fall off a cliff and he'd pop right back up. And we have video games today where our young people play different video games and they can reboot or go to another level. The point I'm trying to make, is it possible that some of the young people don't realize suicide and death are permanent?
Absolutely. So when we talk about, developmental age, so most of the kids that have suicidal thinking or that have suicide attempts are usually between the ages 10 and above. Those kids definitely with functioning at a normal developmental level with no cognitive delays or neurological deficits where they may not have age-appropriate developmental age, those kids normally have an idea of finality and what death means. Those kids are a little younger than that, so if you see kids that are 6 and 7 that endorse suicidal thinking, that's when we really question the kid if they really know. So a lot of times, like you just said, video games. They play video games all the time and the person just pops right back up. So we ask those young kids, what does that mean? Does that mean when you say you don't want to live anymore, does that mean you get to see mommy again or not? And sometimes we'll get kids say, oh yeah, no, I'll just get up and I can see mommy tomorrow. And so then we really know that kid probably does not mean when they say they want to die. They've likely heard someone else say it. They've seen it on TV or even in a video game. I mean, there's some not great video games out there that do have a lot of death and things like that involved, and they could have picked something up from a video game. But usually when we have kids that are late elementary and definitely adolescents, they usually know the finality of death and suicide means they will not return and that they don't want to be here anymore, and they know they will never see their parents or go to school and things like that.
Are you seeing an increase in adolescents trying to commit suicide with over-the-counter medications?
Yes, we are. And there's kind of a couple of buckets when we talk about that because, there's the access to over-the-counter, right? So whatever's in the home, when a child becomes hopeless or they get to the point where they feel like they want to die, then they're just looking for something that they can find to do whatever they are thinking about doing. Then there's the other piece where there's been history of kind of what we call these challenges or things like that that have been online or on some of the social media panels where they're doing these behaviors where they're getting high or they're attempting to get high on over-the-counter medicine like Benadryl or like melatonin or things like that, but it can lead to death because of the fact that it's not safe to take in large amounts, and some kids are not aware of that part. So that's almost two buckets. So we see kids using those drugs that they can find in the drugstore easily to get high or think they're getting high that unfortunately may die from that, or they're using those pills to overdose when they're feeling hopeless or suicidal because that's what they have access to in the home.
Dr. Carter, you've done a great job of answering my questions, but I always like to ask guests this question. What question should I have asked and given you the opportunity to answer that I did not?
I think the only thing we didn't talk about is that sometimes it's still in our community, in our world, there's a stigma around mental health. There's the stigma that if you're depressed or you're sad, that means you're just weak, or that means you just need to make it better on your own. And what we need people to understand is that having depression or suicidal thinking or any mental illness, bipolar, anxiety, there is a biological component to that. It's not just someone's too weak and they can't handle it. There are so much evidence and studies that show that it can be effectively supported and treated with the right treatment, including therapy as well as medication. There's a biological component to it. So I tell my families, just if your child had diabetes or blood pressure, we would tell you to work on their eating habits. We want them to lose weight. Those are things you can control at home. But they may need medication also to help manage that level of their blood pressure or their glycemia. So just with depression and anxiety, yes, there are things that we can teach you to teach your child to work and cope better, but they may need a little bit more help to target that biological component that cannot be fixed otherwise. It may just need that extra support. And I think when people can start to accept that it's okay, doesn't mean you're a bad person or you're a negative person or you didn't do something right because your child is depressed or you're struggling, then getting that help is much easier. Just like if you were to go to the doctor because your kid is sick, you want the help, you want to fix them. It's the same thing. So I think it's making sure we break down that stigma that mental health is a totally different component than medical help, because it is a medical illness. It is something we can treat medically, and that's why we have medications that have been studied and approved and can effectively treat it. And so I think it's important that parents and families realize that, and realize that suicide is preventable, right? It's not something that just happens to people. There are warning signs. There are things that we can try to do to support our kids and our adults before they get to the point where they feel so hopeless that they don't want to live anymore.
We've been listening to Dr. Kia Carter. She is the co-medical director of psychiatry at Cook Children's in Fort Worth. They have an upcoming Joy campaign that they are launching. Information will be on their website. If you just Google Cook Children's Fort Worth, they'll be right at the top. If you missed some of this interview, check all of our show out on our podcast, The Human Side of Healthcare. Have a great and safe week, and we'll see you again next week.